Okay, my name is Dr. Maria Daves. I'm a practitioner counselling psychologist and I work here at Harley Therapy. My qualifications are I have a practitioner doctorate in counselling psychology, I am an accredited Engage coach and I'm also an organisational consultant. I'm also accredited in using the DISCO Autism Diagnostic Assessment, the ADIR Autism Diagnostic Assessment and the ADOS, the Autism Diagnostic Observational Schedule Assessment for those wanting to pursue an autistic diagnosis. One of my main reasons why I entered into psychology is that I was always interested in how people function and also understanding the needs of others, especially their emotional and psychological needs. Also, one of the reasons I got into psychology is on a personal note, having got extended family that have a diagnosis of ADHD and autism, and I found these particular areas fascinating and I'm very passionate when it comes to autism and ADHD. I have over, 22 years working with those with autism spectrum conditions and over 10 years working with ADHD. I've worked in the NHS, inpatient and outpatient, as well as with community services, and I've worked in private services, and now I'm at Harley Therapy. I work specifically with those with autism spectrum conditions and ADHD. These client groups present with a range of difficulties when they come into my practice, often elevated anxiety, depression, trauma, as well as OCD. And a part of my work, although I am employed here as an ADHD coach, I do provide individual therapy to work on these secondary mental health difficulties. Often the mental health difficulties that I work with this client group tend to come from the core difficulties relating to their autism or their ADHD. Other ways in which I contribute in this field is that I do offer lectures in ADHD and autism, and I also provide training for organisations, particularly within social services, as well as in the corporate world. Things what to expect in the first session are usually it'll be a 50-minute appointment, which is known as an initial assessment. So this would mean that I would tend to meet with you on an individual basis to find out why you're here to see me and why now in your life. Lots of individuals that come to see me that are autistic or have ADHD often don't quite realise how it impacts them. So I tend to start off with quite a bit of kind of post-diagnostic work, if you want. So we work through how does ADHD impact that individual? How does the autism impact that individual? And so we get a good understanding between us about what to work on. Often individuals that come to see me is usually to manage anxiety or depression, which has come out of the core symptoms of their autism or ADHD. Now during that session, I want to get to know you and you want to get to know me too. So we work through together to see if we are mutually compatible, and by doing that to see if I can specifically help with your difficulties. In terms of length of time with therapy or coaching, typically we would negotiate the amount of sessions between us. And this would depend on the particular goals that we've highlighted together or aims. Usually it's time limited, however I can offer longer term therapy if this is what is needed, but this will be usually discussed between us. So there is quite a flexible approach depending on your clinical need at that point in time. Something else to expect from the session is that you and I would talk together about which modality, therapeutic modality or coaching, will be best suited for your needs. For example, some individuals on the autistic spectrum would require modified cognitive-behavioural therapy, if you like, or more of a compassion-focused therapy approach, as well as those with ADHD tend to lean more towards ADHD coaching and have specific goals and aims that they would like to achieve. And this could be working on their attention skills or working with their impulsivity.